The way we interpret cholesterol has changed dramatically over the past few decades, but many of us are still accustomed to looking at that total cholesterol number. Or I have patients that tell me, well, doctor, my ratio is good. But more than the total cholesterol, or even that ratio, it's the breakdown of the types of cholesterol that you have that actually matter. So let's go ahead and discuss the three main components of your cholesterol. LDLC, this is the low-density lipoprotein, or the bad guys. We want to keep this number as low as possible. Ideally, aim for less than 100 if you don't have heart disease, less than 70 if you're high risk for heart disease, and less than 55 if you already have heart disease. And as a cardiologist, I'm always using medicines to lower this number to reduce my patient's risk. HDLC is the second component. This is the high-density lipoprotein. You want to keep this number as high as possible. Try to aim for at least greater than 60 milligrams per deciliter. Now, medications don't work to raise this number and reduce your risk. So you have to raise this number the good old-fashioned way, by losing weight, exercising, and cutting down how much alcohol and fat you're taking in. And finally, triglycerides. This is another marker of risk, and you want this number to be ideally less than 100 milligrams per deciliter on a fasting blood test. Remember, high cholesterol doesn't cause symptoms, but it is far from benign. In fact, it is one of the most toxic substances to your arteries and can increase your risk for stroke, for heart attack, for dementia, for kidney disease, and for many other problems by causing plaque buildup in your arteries. So be sure to check that cholesterol every year at your physical and talk to your doctor right away if your numbers seem to be out of range.